Hi, everybody. I'm Dan. I've got Dr. Bilski here again. How are you?
Good.
Morning.
How are you?
Morning. Good. So, a lot of times you have these emergencies, right? But at the same time, every day, it seems like every day, but then you also have the procedures that are just, they're cleanings and all of that. Mm-hmm. Let's talk specifically about emergency root canals today.
Yeah. So emergency root canals, I think, is everybody's nightmare. Mm-hmm. I even have dentists that are patients of mine that still get freaked out about it because they know what's going on. But here's what you have to know about.
Before we go any further, do we really want to know what's going on?
You do.
Okay.
You absolutely do.
All right. Let's hear the scary stuff you're about to tell us.
All right.
It's probably good that you guys know.
You should know this. Mm-hmm. So there's a lot of reasons why you can have a root canal. And most of the time, it's either from a cavity that was you knew about or didn't know about, and it kills the nerve. It just dies. Okay? There's a lot of physiology. We're not going to go into that right now. It's there. Sometimes the nerve dies and creates an abscess. You can get a swelling. It doesn't hurt, or it hurts a lot. Or you can have a cavity that we clean out, and it's called an exposure. So we enter the nerve because we have to take the decay away from the tooth.
Okay.
So the analogy that we use is just picture a hard-boiled egg. We have to go through the egg shell, which is the enamel, to clean out the egg white area, where the decay is. Okay. And if it goes into the egg yolk or the nerve, it's called the pulp, we have to remove the nerve and then fill it in with a calcium biotic. It's not an antibiotic. It's a calcium sealer. All right, that helps the tooth pH get back to normal. It's a lot of chemistry here.
I was going to say, this sounds complicated.
And it seals it. But the fun part of this, now here's the thing. I like doing root canals.
I was going to say, rumor has it you guys are experts in root canals.
Well, I wouldn't say experts.
But it's just something you enjoy.
Yeah, because there are dentists, which I love, endodontists. They are the specialty people. They go to school for an additional 2 years to only limit their practice to root canals. And most of the root canals are done by general dentists like myself, and it's purely because of people just want to stay within the facility that they go to. So we call it all under one roof.
Okay.
All right. So back to the root canal part of it. I am a key opinion leader for Comet USA. They make a specialty drill that if I'm supposed to go 20 millimeters, when it gets to the tip of the root where we're trying to clean out the nerve, it stops. I suppose I could drill past it, and like you've heard before. Yeah. He drilled past, I lost my tooth because the doctor goofed it up.
Gotcha.
This almost makes it impossible to really injure a patient. So with that being said, we can do front tooth root canals in about 10 to 15 minutes.
Okay. Wow.
And there's other procedures that need to be done within that, but the actual root canal, numbing, cleaning the nerve out, disinfecting, we use a CO2 laser from DECA, which is a nice product, seeks water, evaporates the water, kills all bacterial viral contaminants, particularly in COVID. So it is a very safe procedure.
How do people know they have a root canal? Is it pain, or is it something you guys identify that they have?
So they wouldn't know they had a root canal. They know that they have either pain or they're going to have an abscess show up on an x-ray. And we identify that as the people in dental to tell you that. So if you have an abscess, that's an infection. We need to clean that out. We use our specialty equipment to clean it out, fill it with the calcium biotic and a little plugs called gutta percha.
Okay.
Seal the back of the tooth. Sometimes you need a support post. Sometimes you don't. But the actual emergency part, you're coming in with a toothache. We take an x-ray. You just want to be numb. You're that person that doesn't care what I do now. It just hurts that bad. That's the Novocaine. Get you numb. Pain subsides. It's called open the tooth. Remove the infection that's in the tooth. And at that appointment, if it's not as severe as it may feel, we'll complete the root canal by using that calcium biotic and sealing it. So another analogy is wine bottle, cork, molted wax, stick the cork in the wax, and seal the bottle. It's not the cork that seals the bottle. It is the wax on the cork.
Gotcha.
The cork is a carrier.
Right.
That's how we do a root canal, if that makes any sense.
Yeah. You know, one thing we never really talked about, so root canal sounds like something we can tag this onto, but pain after the fact. I'd tell you this quick story. I think I don't remember, this was a while ago, but I had a procedure done and it was like in the middle of the workday and I was like drooling all over the place. I was trying to go back to work and it was like, I couldn't do it. I don't know. I don't even remember if I went back to work, but I remember like drooling all over the place. We could talk about that in a different video. We'll stick to root
It's probably Dan, because I've never heard this before.
I don't know what happened. Maybe I was just super sensitive. Tooth? I don't remember.
Lower tooth?
I remember them numbing me. Yeah. And I just remember like I couldn't stop drooling after the procedure. Probably totally just me. But you guys can laugh about it. I'll try to be nice and just stay to root canals here, but there are probably some procedures you shouldn't go back to work right away. At least wait an hour or something, whatever it takes for that numbing to wear off.
On the planet I live on, the people I work with, and the patients I see, most of the bosses, or if they're bosses of themselves, they know, hey, boss, I just had a root canal. Yeah, and it's kind of like the automatic hall pass, if you will.
Exactly.
I think I can come back. It's 9 o'clock in the morning. Yeah. I think I can be there by noon.
Yeah, exactly.
I think that's
normal. Just let it. Yeah. So anyways, that's just a little tip for you is if they're going to numb you up, maybe plan an extra hour or so after that procedure.
That's
just
funny,
to kind of like let everything kind of go back to normal.
But again, it's funny to us. Yeah. We take this very serious.
It was funny back then, actually.
Yeah, and I think most people that understand that are reasonable, it's going to happen.
The worst is when they try to make you talk and they know you're all numbed up. That's the worst. Anyways, guys, have a great day. Hopefully you got a little bit of a laugh out of that. But root canals, definitely talk to Bilski and his team.
Yeah, for sure.
Thank you.